All right, I'm still seeing that number climb as people continue to join us. I'll just give it another moment and then we will go ahead and get started. Okay, I'll just ask my team to double check and do a final sweep at the waiting room, and we'll go ahead and get us going here. So good morning, everyone. My name is Tracy Marshall. I serve as the Division Director for Colorado's Paid Family and Medical Leave Program. I'm joined today by Joshua Mayers, who serves as our branch manager for our claim management team, and then also several members of our policy team to help answer any of the nitty-gritty questions you may have, and also our wonderful communications team who have put together today's presentation and hosting facilities for us. So today we're going to be focused for you on our new healthcare provider portal. We will also have time for many questions at the end if we're not able to answer those questions during the prepared presentation slides for you. Just some quick housekeeping. So this presentation is being recorded and it will be available on family.colorado.gov shortly following the webinar. We'll also share it with everyone who registered with us. Please plan to ask any questions you may have in the Q&A function of the Zoom meeting, as the chat has been disabled. Our team of panelists will be using the chat, however, to provide helpful links as we move throughout the session. So a quick look at our agenda for our time together this morning. We'll go through what FAMLI is. We'll take a look at the life events that make someone eligible for FAMLI coverage. We'll talk about serious health conditions. And again, we're going to be focused on that portal, which is specifically for our healthcare providers. We'll also look at determining the length of leave, so that duration of a claim, and how you can help certify your patients for their time away from work. So let's start by having a quick look at the program itself. As you may already be aware, FAMLI will provide paid leave for Colorado workers to take care of themselves and their loved ones during certain life events, and we'll get into those more in a moment. The program will cover almost all workers in Colorado, including those who are self-employed if they wish to participate. The FAMLI program is a social insurance program with both employers and employees contributing to the fund that will pay out benefits very soon here on January 1st of 2024. The premiums are set at 0.9% of the employee's wage, with half of that being paid by the employer and the other half being paid by their employee. The initial FAMLI premium rate is fixed at 0.9% through the end of 2024. And then from 2025 and beyond, the director of the FAMLI division will set the premium rate according to a formula which is based on the monetary value of the fund each year. FAMLI premiums are capped at 1.2%, and that's by our statute. What we've seen in other states is that they have over time been able to decrease their premium and increase their benefits. We're hopeful that we may be able to see that same kind of outcome. Taking a look at where we are on the FAMLI timeline. So we've just wrapped up the third quarter and we're in the final quarter now of 2023. We're working very hard to make this program work for everyone in Colorado. And we understand that many healthcare providers are also employers. So if you are an employer, you're probably already familiar with My FAMLI Plus Employer. That's the portal where Colorado employers go to upload wage reports, add their premiums, and take care of their employees as staff members. If you are an employer and a healthcare provider, you're a special group that we will be asking to register twice, once in My FAMLI Plus and again in My FAMLI Plus Employer. Before the end of the year, the My Family Plus portal will open for all Colorado workers. We know that many of the life events we've discussed don't happen on a schedule, but for life events that you can see coming, such as the birth of a child, or perhaps a surgery you're planning to have in the early part of 2024, can be somewhat scheduled. The My Family Plus portal will be where you'll start the process to apply for family benefits. The final step is coming up really fast. So January 1st is the day we've been preparing for. It's when family benefits become available for almost all workers in Colorado. And we're going to dive into that a little bit more deeply. So on the next slide here, you'll see that FAMLI provides up to 12 weeks of paid leave for Colorado workers to take care of themselves and their loved ones. Those who experience pregnancy or childbirth complications may be eligible for an additional 4 weeks, giving them a total of 16 weeks of leave. Covered workers will be able to apply for paid family leave benefits during certain life events. These would include managing a serious health condition, caring for a new child, including those that join their family through adoption or foster placement, making arrangements due to a loved one's military deployment, or to deal with the immediate needs and impacts arising from domestic partner violence or sexual assault. The program again will cover almost all workers in Colorado, including those who are self-employed. So if we take a deeper dive into the serious health condition that qualifies somebody for family leave, what exactly does that mean? On this slide, you can see the definition of serious health condition. The law defines this as an illness, injury, impairment, pregnancy, recovery from childbirth, or physical or mental condition that involves inpatient care in a hospital, hospice, or residential care facility, or continuing treatment by a healthcare provider. Next, I want to share the legal definition of healthcare provider under the FAMLI division. It's defined as any person licensed, certified, or registered under federal or Colorado law to provide medical or emergency services. This includes, but is not limited to, our physicians or doctors, nurses, emergency room personnel, and midwives. One thing to note is that we understand some people eligible for family leave will also be caregivers. If your patient's family member is applying for family leave to care for your patient, you may be asked to fill out that serious health condition form for the family member as well as for the patient. Your patient's family member may qualify for time away from work to provide care for your patient based on the information that you provide. Now that we've reviewed the program itself, we do want to emphasize the important part that healthcare providers will play in the claim filing process. It's certainly not overstating when I say that we could not do this without you. Individuals will use My Family Plus and they'll file a claim. The family division will receive that claim, and the healthcare provider or their delegated staff member will certify the patient's medical condition. The family division will make a determination based on the individual's claim information and that provider's expertise. And then the individual will receive their family decision and benefits. Healthcare providers play a critical part in the claim process. We need our healthcare providers to register and verify their license in My Family Plus. If they are not registered and verified, this will slow down the claim process for their patients and potentially delay their benefit payments. When healthcare providers are not registered, this creates additional steps and ongoing paperwork. The family division needs your help in this process by registering and verifying your license in the My Family Plus system. This will mean that your patient's claims can be adjudicated much faster and with fewer administrative headaches. Based on what we've seen in other states, we are anticipating a very large number of applications when FAMLI opens the portal for Colorado workers at the end of this month. We estimate receiving 30,000 applications in the first 90 days, and the majority of those will require healthcare provider verification. I'm going to hand you over to Josh, who's going to take you through the actual portal itself. Thanks, Josh.
Thanks, Tracy. Hi, everybody. Before we get into the healthcare provider portal, I want to pause here and point out that this is not the same as the MyFamily Plus employer portal that Tracy already spoke about before. I know many healthcare providers have private practices and are also employers. So if you're in that category, this might sound a little familiar to you, and you might be thinking, hey, I've already registered and done my part. That's not the case. We need you to go into MyFamily Plus employer, where you'll send those wage reports and premiums, as we mentioned, which is completely separate from the benefit side, which is the MyFamily Plus portal. Let's see, today we're going to talk about the MyFamily Plus, which is for the claimants in the healthcare side. So if
Hey, Josh, sorry to interrupt you, sir. We're struggling to hear you a little bit. I don't know whether you can get any closer to your mic.
That fix. Is this any better? I'm getting closer, but I don't see my earpiece picking up either. One sec, I apologize for technical difficulties. Connecting my earpiece. Hey, how about now? Is that sounding any better?
That is sounding better. Yes, thank you.
Check.
And if you don't have your captions on, you guys might want to turn your captions on as well if you're still struggling to hear Josh a little bit.
Can you guys hear me?
Yes, much better.
Yeah.
Okay. Sorry about all that. Yeah. Thank you for letting me know. And all right. So to recap, I was talking about the MyFamily Plus employer portal, which is different from the MyFamily Plus. So right now on the screen is the MyFamily Plus employer. So hopefully if you guys have any questions on that, you can go back and look at our other material. We're going to go into the MyFamily Plus. So if you would select the next slide for me. Let's see. Okay. Here we go. Next, I want to tell you all about the important tool that we've been building for the healthcare providers. This is the MyFamily Plus portal, and a big chunk of that is the healthcare provider portal. MyFamily Plus is the online application system that Coloradans will use to apply for benefits, and will also allow healthcare providers such as yourself to support their patients by certifying the patient's claim for family benefits based on their patient's condition or treatment plan. The MyFamily Plus healthcare provider portal is now live, and the portal is where providers will register, verify their license to practice, add staff members to access their accounts, and support in managing their patients' claims. Once we open the system up for all Coloradans later this year, providers will be able to medically certify those claims in the MyFamily Plus portal. One important thing to remember is that every provider will need their own account. Each account can only have one license linked to it. We'll get a little bit more into that as we go on. Healthcare providers that register directly in the system will provide an elevated patient experience by shortening the claim process. This will directly help your patients and their families when serious health conditions prevent them from working. Registering will also get rid of excess paperwork and ensure that your patients do not experience any financial distress while dealing with potential stressful health situations. Okay, healthcare providers in Colorado can use the portal to avoid paperwork and make life easier for their patients who are experiencing these stressful events. We know that no one goes into medicine because they like doing paperwork. So here's a simple glimpse on how we'll get started using the portal. First, we need you to go to our website, which is family.colorado.gov, and navigate to the Healthcare Provider tab. You'll click on the button to log into MyFamily Plus. If you're using a login.gov account, you can use the same one that you've used in the past. If not, you'll need to create a new one, and the prompts will walk you through all that. We also have great how-to videos on our website that show you how to do this, and we'll drop that link in the chat. Okay, so once you've created the account, which is pretty much just putting in your email address and information, then you have access to your healthcare provider account. The first thing you'll be prompted to do is for you to complete your healthcare provider verification. And if you're returning to complete this verification, you can do it from the dashboard. So it's very easy. Verification of your credentials is an important step in protecting your professional credentials when requesting leave starts pouring into My Family Plus. To complete your HCP verification will require you to upload your government issued ID and then a copy or picture of your credentials. This information will be used to verify your account with cross-referencing them with the state and federal databases. Now, please note, screenshots of the DORA website are not permitted. We need a copy or picture of your actual license and not a screenshot showing you of the status. And we do that because the DORA website is all public record and information. We're trying to get you to upload the credentials so we can look at it, verify it, and say, yep, this doctor is legit and nobody has stolen your credentials. Okay, we understand the healthcare providers are very busy during the day and may not have time to do this themselves. So healthcare providers can delegate their account to a trusted staff member or members. This will allow those trusted individuals to manage the account on behalf of the licensed healthcare provider. We logged in as a delegate. When logging in as a delegated staff member, that person is acting on your behalf or on the behalf of the provider on the account. So you can have multiple people, maybe a system admin, medical assisting staff. All those people would see the same notifications that you get, but they would be able to verify the claim or certify it because they're acting on your behalf. So keep that in mind. Anybody that you add to the account does not need to then upload their own credentials. That is different. If you're a delegated staff member, is also a healthcare provider, maybe a nurse or something, and they'll be certifying their own claims, they should not upload their own nursing license to this account. If they do, they'll override the original provider's licensure with their own. This removes the account holder from the system, and that provider will have to create a new account and do the re-verification process. You can only have one license under each healthcare provider account. So a doctor and a nurse who are working alongside each other could both have their own separate accounts in the system. Or the nurse can be added as a delegate under that doctor and be certifying claims under that doctor's credentials on their behalf without adding their own nursing credentials. If you're an administrative worker at a large practice and you're creating accounts for multiple healthcare providers, you must create a separate account for each individual provider and then verify each of their licenses on the account. Again, our system will only permit one license per account. Office admins can create these separate accounts by using their own login credentials through login.gov, but will need to add each provider as an individual account and then add any delegates that they see fit. So hopefully there's no big questions on that. We're happy to help if you guys do have any further questions. Also, I want to briefly cover how to recommend leave for patients that will be evaluated. So when patients take a care of family member or their own medical condition, we're requiring an ICD-10 code to be entered, and you're all familiar with that. If you're listening to this webinar and you're not a healthcare provider, ICD-10 codes are used extremely or extensively in medicine to classify diseases, illnesses, and injuries. Health insurance companies use these codes to process claims. We'll be using them at FAMLI to support the request leave duration only for that condition. So healthcare providers will enter an ICD-10 code, give us a brief description of the condition and the care needed, and then we will use that to evaluate the application that has been submitted for us. Let's see, I think I missed a few. Let's see, determining claims, I did that. Okay, now if you're a healthcare provider and not registered in the system, the patients are going to be required to manually download this form and bring it to your office. The form the patient will bring needs to be completed. When you have filled out this form, give it back to the claimants, and then they will need to be the ones that upload it into our system. You, as a healthcare provider, will not be faxing or sending back those paper claims to us. If you do it in the portal, that is done differently. So to be clear, a serious health condition form is only required if the patient is filing a leave due to their own serious health condition or for care of a family member who has a serious health condition. For bonding leave claims, parents and guardians of those children will only need to upload proof of birth within that first year of the child being placed in their care or being born. And that proof is a birth certificate, hospital discharge paperwork, etc. All right. See, I'm probably jumping all over the place. Where are we? How to certify the claim. When a claimant files a medical claim or a claim opened later in the year, they must provide the healthcare provider details. As a verified healthcare provider in our portal, you or your delegate team will receive a notification on the dashboard that a patient needs to certify their serious health condition form. Here are for a few previews of that form. So it's very similar to the paper form. It will go down. You have to answer questions. It will not let you skip over or omit anything. So that's a good perk of doing it online as well. Here are a few of the items. On the dashboard, you'll go in, you'll see there's a notification alerting you that there's a claim to certify. You'll click on it. First, you'll need to verify that in fact this patient is yours. So if you don't recognize the patient, you would say no, then it would kick that claim off of your to-do list and back to the claimant, and then they would have to select another provider. If you do recognize the patient, then you'll enter in the primary ICD-10 code relevant to the patient's condition. Again, this is a mandatory field, so we require that you do that. You can put in a secondary if needed, but we only require one. Then you'll confirm the requested dates for the leave and make sure those line up with your treatment plan. You'll complete the consent to electronically sign and submit the form, and then you'll click the submit button, and that goes on to our staff for the claim to be adjudicated.
All right, thank you, Josh.
Sorry about that, Tracy.
So if a healthcare provider is not registered in the system, patients of that healthcare provider will need to manually enter their doctor into the system and will be prompted to download a PDF of a serious health condition form that looks similar to the one that you're seeing on your screen. This is the form the patient will then have to bring to their provider to have them complete. When you've filled out the form for them, the claimant will then need to enter all the information, including that ICD code, into our system and upload the signed form to complete their application. Providers, please ensure that your handwriting is legible for your patients. So again, to be clear, a serious health condition form is only required if a patient is filing a family leave claim due to their own serious health condition or to care for a family member's serious health condition. Those bonding claims, they will just need to show that proof that the child that they're bonding with has been with their family for 1 year or less. That proof can be in the form of a birth certificate, hospital discharge paperwork, proof of adoption, or legal custody placement. Josh and I have covered a lot of information in this webinar. If you feel like you want to know more details about how to register, the verification process, or how to certify your patient's claim, we have created a lot of great resources that you can certainly find on our website. We now have 4 how-to videos that you can refer to if you run into any issues, and you're also welcome to give us a call. With the imminent launch of the claimant portal, we'll be adding more how-to videos to show you how to certify your claims once the portal opens up for applications at the end of this month. Again, all of this is available on family.colorado.gov. Just click on the Healthcare Provider tab at the top. As always, we do want to hear from you. It's your feedback that helps us make this program successful. You can find us on all the different social channels. We're on Facebook, Twitter, Instagram, and LinkedIn. And we also do frequent Facebook live chats if that's something that's of interest to your organization. We do encourage you to subscribe to our monthly newsletter, and we do have information in there that's very, very specific to our healthcare provider communities. And that will be the first way that you'll be able to find out when our portal has been opened for claims. So with that being said, I'm going to turn us over to our communications team. I see that there are lots of questions coming in through the Q&A. So we'll get started and do our best to answer as many of those as we can.
Thanks, Tracy. And thank you for everyone for hanging with us through this. And I hope you've learned a lot. And so I will start with the first question. I'll just kind of read it off. And if Tracy or Josh, if one of you want to jump in, and I would say feel free. My provider.
Oh, I think I've lost you, Michelle. I don't know whether it's just me.
Same for me, I lost her.
All right, I'll jump in and do this. So the first question says, my providers want to streamline the process of provider enrollment. Does each and every single provider need to register for their own account? Why can't an office manager do this for the practice? Do you want to take that one, Josh?
Absolutely. So that's a very good question. So an office manager can do this for the healthcare providers. We're just stating that each individual healthcare provider needs their own account. So in this case, that office manager logs in under them with their login credentials, and then they're going to create a new account for, say, 11 different providers. And now when they do that, they will put in that provider's name, account information, so whatever the clinic may be, address, stuff like that. And then they will also need to add that provider as one of the delegates. So then the office manager can also do the verification steps. So if that office manager has that provider stuff, upload it all, go from there, and you're good to go. Now, if you need other office staff to work those claims again, so say medical assistant, you would add that medical assistant to each individual claim that account that they would be helping for. So hopefully this has answered your questions. Office administrator can do it, but they need to open one account for each individual healthcare provider that would be certifying claims. And then that office staff can stay on as a delegate. Anybody that's a delegate is going to get all the communications. They'll get that email if a claimant has filed a claim. So then that office manager could be the one to tell office staff that there's paperwork to be done. So that's how that workflow would be managed, and anybody on that account will see all of that. So hopefully I've answered that question.
Thank you. Sorry, I'm having a little bit of audio problem apparently today. So the second question is from Jory. I understand we have an account for each provider, but can the office manager create the account for each provider? And this might have been something you might have covered in the last question a little bit.
Yeah, and I'd say it was covered, so that office manager can create those accounts. And again, remember that they just need to do an individual account for each of the providers. And then I would add those providers as a delegate. Now that provider technically does not ever need to come into the system. I would just, think it's a good workflow and process to have them on there since you're, working on their behalf. But you can have any unlimited number of delegates, and all that are delegates would see those notifications and paperwork. So if you start getting 500 emails a day from 500 different claimants, that's when you might want to realize having one office administrator getting all that might be a lot. So you could break that down, have one office administrator maybe register 5 providers and go that route. So totally up to you. Just get one account for each provider.
Thanks for that clarification, Josh. Karen was curious if resident physicians with a training license are able to register in the portal and do the paperwork for their patients.
Certainly are, yeah.
Great. Liz was wondering, our providers want to set up a delegate with one centralized method of communication. So this is kind of, again, what we were just talking about with the previous questions for when a patient requests FAMLI, what is the notification process to notify the provider that they have a patient that may be eligible? The providers do not want to be bothered with this communication. They want their staff to handle it. Can we set this up so that the provider does not receive the notifications?
Yeah, absolutely. So those can go to their delegate.
That sounds easy. Anonymous is asking, I created an account for 11 providers, but in the top right corner, they all have the same name on the account. This may be more of a question for our tech team.
Let's see if Kelly can help us with that one.
Yeah,
Okay.
and this is kind of part of that problem too, where having one person setting up lots of accounts, it starts looking wonky because the top right shows the name of the person that is logged in. So if you set up those 11 provider accounts, added the provider as a delegate, if they get the email, go to log in, you get that 6-digit code for them to log in. When they log in, they should see their name in the top right corner. So you'll only see the name of the account that you are in, and that's where we preferably want providers to go and set up their own accounts, add people as delegates. That way we know it's all being set up. But I don't know if anybody on the technical team is able to chime in on that.
Kelly?
I can also comment on that. So Josh, you're 100% correct. We do ask that when you are completing additional registrations for healthcare providers, there's text that indicating the name in which you should be populating. So if it will specifically say populate the practitioner's name or the delegate name if you're on that step. But Josh, you're 100% correct.
Great. Well, thank you for that clarification. And then Liz is asking, how is a notification sent to the provider that they have a patient form to fill out? She was wondering if there was an email sent in particular.
Yeah, I can take that one as well. So yes, you get two things. One, if you happen to be in the portal, you'll see a little pop-up that a task is to be done, but the primary notification will be an email, and it will go to the emails set up on that account. And again, all the delegates. So everybody that is a delegate on that claim would get an email stating, hey, there's a new work item to be done in your My Family Plus portal. That's all the information that's on there. So then admin or office staff would go in, log in to the account for that provider, and then they would see that they have a task. And that's when we would start that serious health condition form. First step would be verifying that is your patient or the healthcare providers, and then filling out the form.
And then Tracy, Kristen was wondering if the forms will be available.
Kristen, we're not going to be publishing the forms. All of these forms are going to be created on a individual unique basis, one by one per claim per patient. Your patient would need to print those forms and then physically bring that over to your office. So we don't have blank versions of the forms, and we have no plan to release those.
Here's another good question too from an anonymous attendee. They were wondering if it will be up to the patients to notify their provider that they are submitting this, so then they're prompted to log in. And as we've talked about in just the question before that Josh answered, was there's going to be an email notification given. But Josh, you want to take the rest of that question?
Yes, so we're definitely hoping that you and your patients are having the dialogue back and forth, but they could select you in the claim filing process without you having any recognition that they're filing a claim. And that's why, yes, the system will trigger that task. And that's when you can say like, hey, I don't even know this person. So maybe they're doing it and you haven't seen them yet. You could kick it back, or you could just sit there and wait, and hopefully that patient comes back in. The onus is on the claimant here. So if you guys never fill out a form, we're not going to follow back up with the healthcare provider. What we do is get notice to the claimant that, hey, their claim isn't completed or they haven't submitted this form, and our communication goes back and forth with them. So they may come to you afterwards and say, oh yeah, I did file a claim, here's the paper, or yeah, I selected you and you should have seen something electronically. So you might see any variation or combination of those situations, but hopefully they've had a talk with you ahead of time and are aware of this program, and you guys are having that dialogue.
Thanks, Josh. This one might be a question for David, but I'm not sure. Maybe Josh, you might, or Tracy, you might know as well. We currently bill for portal messages and bill for forms that our providers complete. Can we bill for the time that we spend in the portal providing either approval or denial?
I would start by referring that to Tracy.
Thank you.
Yeah, that's fine. So, the process that you use internally to bill your patients for your time, that's inherent to your business. It's not something that FAMLI provides any control of. I would say that once you are in this system, you're going to find it to be a lot quicker for both yourselves and for your patients than a traditional paper form. But I would encourage you to use reasonableness as far as you're able to for your patients.
And then Bethany is asking, did I hear that a license printed from DORA is not accepted? If so, why is this, since it's coming up from Colorado and shows the provider's name, license number, active dates, and the status? Tracy, do you want to handle that one?
I'm actually going to pass that one over to Josh because he has been seeing so many of these specifically.
Okay.
Yeah, so a printed off certificate from DORA is okay. That's what we want. We just don't want a screenshot of you looking at DORA's website that shows your license number and expiration date, because that's what we can look, and we're using that to verify. So whatever license you have from DORA, that's what we're wanting. Take a picture with your camera, upload the actual certificate, take a picture, of that hanging on your wall and give it to us, because that's what we're doing to look at that along with your photo ID to say, hey, this provider is legit and we didn't just grab their information off the dark web, and now we're certifying medical claims using your license. So hopefully that helps.
A big motivation for us doing this for our healthcare providers is to help maintain the integrity of the credentials and license that you've worked so hard to obtain, and that you wish to keep them free from fraudulent use, right? This is something that's been seen in other states where paper forms could be filled out by a bad actor and a name is applied to that paper form with an ineligible signature, and that's being passed off as being a legitimate healthcare provider form, and it may never ever have had your permission. We're trying to make sure that we can keep everyone's professional credentials as safe as possible, and this is a big motivator behind why we've created this system.
An anonymous attendee, I think, some clarification is probably in order here. How is a provider supposed to prepare if there is no blank form to review? And I think I know Josh has kind of covered this a bit in the slides. So maybe some clarification, Josh, on that.
Well, again, it's the communication back and forth. So the claimant can file up to 30 days before needing this or up to 30 days after. So sometimes this will happen, hey, car accident treatment or something, they come in after the fact, they're going to miss work. So that's when they've been seeing you. Oh yeah, I got this. You as a healthcare provider could maybe say, hey, are you aware of FAMLI? Maybe this person isn't knowledgeable on it. So then they would have to come back after the fact, file a claim to us, and then, bring a form to you. That's just nature of the beast. We can't, have the forms out there because each one of them, as Tracy mentioned, is unique to the claimant with barcoding information. So that way we keep all their information safe on our portal. That's, I think, the best I can say. Again, it's the communication coming up. If they know they're going to have surgery in a month, they've probably been seeing you a few times. So this isn't the first time you've seen that patient. So now it's, hey, they're going to be out recovering or something. And that's where I was saying you've probably seen these people once or twice for the most part. If you're an emergency person, it's going to be there, or they're going to come back. Hey, look, I was at this hospital or urgent care, the scene. Can you have somebody complete this form for us?
Great. Thanks, Josh. And the nice thing about our system too is when your patient goes in and starts their claim and they bring their paperwork in after they've downloaded it and printed it out, some of this will be pre-filled out that they've already entered for you. So hopefully that will help as well. Let's see. Providers will, an anonymous attendee is talking about FAMLI and some standard FMLA paperwork. So what they're asking is providers will need to complete this form online in the portal for FAMLI, and then there will be a separate paperwork for the FMLA that will need to go back with the employer to their employer or back with the employee to their employer, sorry. Shouldn't the form go to the employer so that they can log the FMLA leave?
So we will be providing some information to employers, but not information that's specific to an individual's health condition. We would never share with an employer an individual's ICD code or similar diagnosis. What we would share with an employer is that they're out for a leave reason that makes them eligible for FAMLI, and that we have evaluated and approved that time away from work for, let's say, 6 weeks. The employer can then certainly utilize that information to be able to determine their FMLA concurrently. So that's the information that we will be providing to employers. We just won't share with them the ICD information. So that's no different than you would find today if you had a patient that had FMLA and perhaps a short-term disability program. You may still find in those situations that there is more than one document involved.
Thank you, Tracy. Janine is asking, once the serious healthcare form, I believe that's what she's referring to, is completed by the provider, will the provider be able to save a copy of this for their own office?
Absolutely, I can take that one. So every claim that is done digitally in the portal, yes, you get a PDF version and it's kept in that account record of all the claims that have been processed. If you do the paperwork manually, then it's up to you to make a copy for your own office records. But if you do it digitally, yes, it is recorded in your account and you have access to that.
Great, thank you, Josh. Lynn is wondering, kind of back to the process, or she was wondering if we have a recommended process for an office manager who is registering for other providers, and how, if there's a quicker way maybe to verify each of those providers' IDs.
Unfortunately, there is not a quicker way to do it. Right now, again, we need one account per healthcare provider. So if this office manager is the one that is going to do that for X amount of people, each one of those claims, then they have to go in as that delegate or person, upload the appropriate credentials, and then that triggers workflow by our staff to go in, and then you'll get notification on that account once the account has been verified or not. But there's no bulk way to go in and register multiple healthcare providers at this time or accounts. We're looking into that for a future build out, but right now with our timelines and deadlines to get the program going, we just weren't able to get that done at this time.
And I'll jump in here, Josh, as well. I know I'm seeing questions in here about the amount of time it's going to take and those things. What I would say to our healthcare providers is the lift on this is happening at the front end. The ask of you is happening now to just spend that kind of 5 to 10 minutes getting registered in our system. Once you have done that piece, that's the hardest thing that we're going to be asking you to do. The actual certification process, once we open up that system here at the end of the month, you'll be looking at under 2 minutes to get those claims approved. A lot of the areas will be pre-populated for you, including you'll be able to see the dates that your patient has asked to be off work, and you can state whether or not you agree with those dates the patient has asked for. The patient will also be putting in there whether or not they're requesting continuous leave or a reduced schedule, and you can again confirm whether or not you agree with those requests that your patient has made. We're trying to make sure that you don't run into the experience of not checking a box on a paper form because you had no idea how critical it was, and then you find out that your patient's claim gets denied. The sooner that we can get these requests done through the portal, that means the faster your patients will be able to receive their paycheck, and they'll also have that assurance that they won't lose their medical benefits and that they'll be able to continue the care that you've prescribed for them in order to become well and return to the workplace when you tell us that they're able to. So I totally, I'm in healthcare myself. I've spent 30 years as a registered nurse. I get it that this may feel like a lift at the beginning, but it will have an amazing long-term effect to streamline this process for your office moving forward and for your patients long-term.
Thank you, Tracy. I know that, and I just wanted to kind of chime in to add a little bit to what Tracy was saying. Tracy and Josh have worked in the healthcare industry, as Tracy and Josh have both mentioned, and they have been trying very hard to make sure that they can streamline the process. They understand very implicitly how busy healthcare providers really are. So that was really their main goal with all of this. We have an anonymous attendee who is wondering when patients will, or when the portal will start sending requests out. Josh or Tracy, would you like to take that?
I'll take that one. I'll say you can anticipate seeing these requests before December 1st. So you really have this month to get geared up and be ready. But you should anticipate seeing the first ones of these come through to your office before December 1st.
Thank you. Let's see. One of our anonymous attendees is wondering if the family paperwork will comparatively to the FML paperwork, if it will be similar or if it will be a little more, is one going to be more time consuming? Do you have any thoughts about that?
Ours is way easier. So the prior life that Josh and myself came from was in that private sector, short and long-term disability and FMLA adjudication process. We've definitely tried to leverage the experience we had in that field and make these forms a lot easier. I know I've seen forms coming out of other states that have been 16 pages long. We are not doing that to you. We will not do that to you. Our documentation only has the necessary fields that we absolutely need to be able to adjudicate one of these leaves. They will be short, they will be simple, they will not require a lot of your time.
Thank you, Tracy, for that clarification and added information. Sue was kind of back to the registering for providers. Sue was wondering, can each of our providers use the same email, like a central email for patient claims? Josh?
I'll take this one. So when you set up your account, I would say no, have your own unique email address. Now you can add the system administrator office person as a delegate, and that email address, have your office paperwork.org email address or whatever you want, but don't use that when you create the account, because that's the email address you need to use when you log into the system. And if everybody's trying to use the same email to log in, that's where you start getting a little bit of problems. So I recommend personal or a different dedicated email address for the account, and then add your office admin as delegates and use that common email address that way. And then again, anybody added as a delegate. So if you want all those notifications going to that paperwork, to that person, that's how it will get to them. And then the providers can, you know, block or put those other inbound emails into a junk folder, and then let that office staff be the ones, oh, hey, there's a new work item. Then they would log in under that person's account and then do the work for them. So hopefully I've addressed that one.
Thank you, Josh, for explaining that so thoroughly. I think that was very helpful. And I have, this is kind of switching gears a little bit. I had a question from another anonymous attendee. They're curious about the relationship of the family member and how it's verified by the state before or while the paperwork is being submitted to the medical provider for approval. Does that Tracy, or do we need to ask David for that?
I can also take that one.
Oh, thanks,
so
Josh.
The family member part, again, only applies to certain types of claims. So I'm assuming we're speaking specifically to care of a family member. So
Yes.
Our definition of a family member is vast compared to what FML is. It's pretty much anybody you have a very strong family relationship to. So we, as a family division, will request that information as necessary to determine that relationship, but we're not making it mandatory. So if you file for your grandparent, we're not necessarily making you show proof of that relationship up front, but we can request that as necessary. So for you, you're just, as a healthcare provider, identifying that this person is who, you know, you're treating and they need care. You don't need to validate that they're a family member. You need to mark on that form that, yep, they're here, assuming you're talking to them or have seen them as well. And, oh, yep, you're the sister, great, here's paperwork, your name is listed as the care. I agree they need time off, and go from there. We're not expecting you to find proof. We would request that proof if we deem necessary.
And I would add one other thing in there, if you don't mind, Josh. So, I think about those situations that all of us in healthcare have seen where we have patients who are, potentially, we'll call them bed blocking, right? I know we don't really like to use that term, but there are people who are unable to go home because there's nobody at home to be able to care for them safely. Some of these folks may have a next door neighbor who is their person. They have no relationship to them through blood or marriage, but that's their person. That's the person who they would call at 3 o'clock in the morning if they fall out of bed, right? Those are the folks that you'll also be able to sign off for if they need to take time away from work to take care of that neighbor. So that hopefully will help some of these people who have been unable to return to home because they haven't had a caregiver to be able to get the care that they need. And again, to follow your treatment plan. But we're not going to be expecting you as the healthcare provider to verify that kind of relationship. We'll take on the responsibility for that.
Thank you. Jory has an interesting question about what about providers who work per diem with another group? Will having different accounts with each group create issues?
So I'll take that one. We actually would prefer it because, again, the claimant is going to look for you as a provider at wherever they sought treatment. So if you are working in 2 or 3 different clinics and having your license stuff, you need 3 different accounts at those places that you are providing and going to be certifying leave. Now, if you're just helping out as like a floater, that's probably when we would have you added as a delegate, maybe under another provider, and you could fill out paperwork, but you aren't the one that's going to pop up there. This is not for billing. This isn't anything like that. So for us, this healthcare provider portal is where the claimant sees you as a registered provider. That's it. If you're not in here with those credentials in there, when they go to find you, they don't see your name. They're not going to be able to select you and therefore forced to do the paper route. So if you're working in 3 different offices, and specifically if you have different licensures, that's another animal too. Each license would need a different account. But I know it sounds cumbersome, but that's how your patients are going to find you. If you're at this clinic on Mondays and they see you, they would expect to put in that location of that clinic and your name. And if they don't find you, they're going to come back with a paper. So hopefully I've addressed that one.
Thank you, Josh. You did a great job. We have an anonymous attendee who is asking about when does, I think they mean the healthcare provider portal open, or well, let's see, when does the employer
I think it could
portal?
be the employer portal. So
Yeah.
I'm gonna guess this person has staff that they're interested in understanding more about. We'll be sending out notifications when one of your employees has been approved for leave. As a systematic view, the portal that will be opening up in the first quarter of next year. We won't have it ready by January 1st, but it won't be very far behind.
Thank you, Tracy. Lynette is asking about hospital providers, such as the doctors and nurses. Will they be registered as well?
So, I think nurses are a really interesting one. If you think of your social workers and your case managers and those folks who are trying to do that discharge coordination and discharge planning, I would recommend that they register. They're certainly going to be able to complete that documentation in lieu of a healthcare provider for an individual that's being discharged from their facility. So it would be good for them to register. Healthcare provider, surgeons, physicians, whatever specialty you may be in, if the hospital environment is where you conduct the majority of your work and see the majority of your patients, then it's certainly going to be fine for you to be registered as a staff member at that facility.
Thank you. Alicia is asking, if you are added as a delegate, how can they find you? And this is in reference to the per diem worker at multiple locations.
So that's a good question. So again, if you are in as a delegate, you are not going to be able to be found unless you have your own separate account already set up. So if you're worried about billing hours or making sure a patient can select you, then you need to go in and have an account set up with the address of the facility or location that you are providing your services at. And if you are doing that in 3 different locations, under your one login, you would need to have 3 separate accounts with, Doctors R Us location here and the other one over that way. So then your patient, if you will, can find you. If you are as a delegate, like Tracy and everybody's precluding to, a nurse that's going to sign paperwork, if they're doing it for the doctor, then they're not going to be found in the system as that nurse. Does that make sense? So the patient is going to be looking for the doctor and not the nurse that was helping. If you are a nurse that is certifying claims and doing stuff, then you need to set up your own account, not as a delegate, put your credentials in there, and then your patients can select you as their healthcare provider.
Thank you. Brian is asking, at birth, will it be the pediatrician or the OB who is completing the claim at discharge?
Either or.
Yeah, you dealer's choice. You guys can arm wrestle for that one.
There you go. We have kind of slowed down on questions right now. And so I would just like to ask Tracy if she has anything she would like to add, and to see if any remaining questions kind of filter in. Oh, actually, never mind. A few more questions have filtered in. But Tracy, if you want to go ahead and say something first before I ask the next question, is there something in particular? Or
let's keep going with questions.
All right, let's do that. Let's see. Will removing a delegated staff member be just as easy as adding them? In the cases of staff who leave the organization, we need to make sure that those who are no longer employed cannot access the portal.
I can take that one. Absolutely. Very easy. You go in as the delegate staff, you'll see all the people that you've selected. You can see their status if they've logged in and or linked to this account, and then you can remove them. Very easy. They're gone and they will no longer be on anything. Then you could always re-add them if necessary. But yes, it's literally a click of a button to remove them.
Yep, they work to tried to make it easy for those kind of modifications to be made. An anonymous attendee is asking if the office is able to require or maybe not require a nurse to have their own account.
I think that's your business preference. So if you have a nurse within your practice who has no ownership of doing this kind of documentation, then you don't need to support their registration.
And one more question about the notifications, if they go to the point of contact, and if so, how is that notification going to be sent and received?
I think this is kind of a flashback to having the employers and talking about the employer portal. The notifications will go to the point of contact. What we're asking you to do is to make sure that we know who the point of contact is in your office. Perhaps you have something like an email box that says leave requests at denverfootphysicians.com, right? Let's make sure that we as the family division knows that that's where you want those notifications to go. If you don't think you have that address registered with us right now, give our contact center a call. We'll make sure that that email address is on file for you, and we'll make sure that you receive those notifications through email. Again, that's if you're an employer and you want to make sure that you're being notified if one of your own employees has been approved for leave by the state of Colorado. So certainly give us a call. We'll make sure that that address is updated in our system for you.
Thank you. Well, we have just a minute left, and it looks like we do not have any questions. And so left in the chat anyway, we can wait and see if there's going to be anything else that comes up. Or like I said, Tracy, is there anything else? Tracy or Josh, is there anything else you would like to add?
Yeah, I'm happy to close this out. I just want to say thank you so much for your time. I know that this is new. I know that this feels like a big ask, but it really is critical that our healthcare providers partner with us on this one. It's the way that we are going to make sure that your patients can have their leaves determined as quickly as possible. And ultimately, our goal is to make sure we can give them that valuable wage replacement, make sure that they can keep their health insurance insurance benefits because they've got that protection from their employer, and also to make sure that they can take that valuable time away from work to follow the treatment protocol that you've recommended for them. So we really do appreciate your partnership on this. And as always, reach out if you have any questions and we'll be there to help you too.
Well, thank you so much, Tracy, and thank you so much, everybody. And we will leave you for the rest of your day.
Thank you. Bye-bye.
Bye.